Hi everyone, it's Patrick out at Sterling Physical Therapy. What we're doing today is shooting a video to demonstrate what parents and people might see at a sporting event if an athlete gets injured. Obviously with Sterling Physical Therapy doing the injury coverage for Pella High, we always hope that you never have to see Travis and I run onto the field or court, but with the reality of athletics, athletes do get injured. So what we've got here today is Grant Barrick, a former Pella High athlete, who's going to be demonstrating. So watching from the sidelines, perfect case scenario is we see the injury happen so that we have a better idea of diagnosing it. But like football, when athletes get kind of mixed up, legs get tangled up, that's not always possible to see. So the first thing is we're running out there, what I'm looking at is the athlete responsive? Now obviously if they're rolling around in pain, I know they're conscious, I know they're awake. So the next thing I'm looking for is any gross deformities. Now if it was a catastrophic injury like a compound fracture, the number one thing I want to do is get that leg stabilized and get the ambulance over. If it's during a basketball game, what we would do is obviously call 911. But for Grant, I run out there, I want to get him calmed down. So if he's in a lot of pain, I might say something like take deep breaths in. If there's a coach or another athlete by him, I might have them grab his hand and let him squeeze it. The next thing I'm going to ask him is, what happened? So with Grant, what he told me is, I was running, I planted my leg down, I felt a pop in my knee, and it gave out. So what I'm going to be looking at the knee here is, I want to see if it's stable. Okay, so at this point, I don't care whether it's in the first quarter or fourth quarter, I'm not concerned about getting this game going right away, I'm concerned about the athlete. So I'm looking at the knee, is it stable? If it's really unstable where maybe he's torn several ligaments, I need to know that so that I'm not trying to get the athlete up, moving him around a bunch. So after I've determined that the knee is somewhat stable, I'm going to ask the athlete, do you feel comfortable enough that we can stand you up? So doing this, because I don't know exactly what's going on with the knee yet, I'm going to have him put most of the pressure, almost all the pressure on the right leg. We're going to have maybe another coach or a player help me up, and we're going to take him off the field to get to the sideline. So athlete on the sideline, on the table. So what I'm going to go through now is some of the tests I'm going to look at for the ligaments of the knee and the cartilage of the knee. So a lot of these tests that I'm going to do on the sideline here are on the table. I've already done on the field to determine, okay, is it stable? But this is going to give me a second chance to just make sure what I found on the field lines up for what I find on the table here. So the first thing I'm going to do is a gold standard, so with the mechanism of injury. So Grant telling me he planted, twisted, and popped. First thing in my head is I'm worried about the ACL. So the gold standard for testing the ACL is called the Lockman's test. Basically what we're trying to do is the tibia bone here and the femur, we're trying to pull that tibia forward, which if the ACL is intact, it should prevent that tibia from coming forward, and I should almost feel a little catch that doesn't let me bring it forward. If it's torn, I'm going to feel that tibia shift a lot more. Now with me, unfortunately, I've got smaller hands, so the way I do my Lockmans, I have one knee up on the table to support his femur. My right hand is right around that tibial tubercle, stabilizing my top hand. I'm just pulling that tibia forward, a little bit of anterior translation, trying to see, okay, is that ACL intact? Now the one thing with looking at this is I've got a small window here where there's not much swelling. So with doing this, I might get a little bit more play in it, evaluate it right away. This is the point with Travis and I being at the games is we can help to diagnose these injuries faster. So another test that I might use too is bringing the knee up. This is called an anterior drawer, so it's just another way to test the ACL, where I'm sitting on the athlete's foot, just a little pressure to keep it nice and stable. I've got both hands right underneath the tibia, and again, I'm just pulling that tibia forward. So you can kind of see Grant, and Grant has a healthy ACL, so right when I bring it out, it locks. So if he had a torn ACL, we would see this shifting a lot further. So once I've determined that, okay, it's an ACL, I'm probably going to make sure and test all the other ligaments. So another thing I might test is that MCL. So gently letting that knee relax, I'm going to do what's called a valgus stress test, where I'm just testing to see if that MCL, which prevents our knee from going in, is stable. So with him, yes, it's stable. Then I'm also going to test the LCL. Again, for a lot of this, you know, the athlete's going to tell me, hey, they felt their knee go in, go out. But again, with them being in pain, they might not be able to tell me exactly what's going on. So I want to make sure I'm thorough with my examination. So with Grant, I'm determining, yes, it is a possible ACL. And I always say possible because we have to get an MRI to truly diagnose if it's torn. So the next step, with us being on the sideline and working closely with Dr. Vincent of Iowa Orthopaedics, if Dr. Vincent isn't at the game with us, we would give him a call on his cell phone. Best case scenario is he says, hey, I'll see the athlete in my office the next morning, get him checked out, and get things going to diagnose what's going on with the knee. If he's at the game, he might be able to look at him right away to get a better diagnosis, and then also help to facilitate to get that athlete in. The nice part about ACLs, it's not a medical emergency. So if we call Dr. Vincent and he says, we're going to see the athlete on Monday, what Travis and I would probably do, we would brace the athlete up if we have the braces with us. If not, what we would do if it's like in an away game or if it's a game where we don't have the brace there, what we'd probably do is get the athlete on crutches, which we always bring to the game, give you instructions on icing, pain management, and keeping the swelling down. And this way the athlete can make sure that they're doing everything they need to up until that visit. Parents should expect is that most likely we're going to bring you down onto the field to communicate what's going on. And you can always expect that when Travis and I look at your son or daughter that, number one, we're going to get your phone number, all of your information, and most likely we're going to give you our cell phone too. And you can usually expect a call if it's on a Friday night game that we're going to call you the next day to check in on that athlete. But also by giving you our number, you can call us if you have any questions over the weekend until we can get you in to see Dr. Vincent. So again, this is just a small example of what we might see on the field. In the next coming months, we're going to show a couple other videos of other injuries that you might see, and this way parents have a better idea of why we're at the games and what we're doing when we're really out in the field.